Some of our state's healthcare institutions are drowning in debt and struggling to keep up with their operating costs.
Things were only made worse when, as we mentioned, the Maine Senate failed to pass that supplemental budget. As News Center Maine's Raya Wooten tells us, it's leaving hospitals in a lose-lose situation.
It does have some reform to the GA. Is it enough?
It is incredibly disappointing to see the legislature play politics with health care in the state of Maine.
Tuesday, all eyes were on the state Senate after the supplemental budget failed. By Wednesday, cuts to Medicaid payments kicked in, capping the reimbursement on Medicaid payments that some hospitals will receive.
Hospitals are already covering almost double what the state provides in terms of reimbursement for those services. So,
forcing healthcare providers to provide care for the sickest patients on the front end, but leaving hospitals in a deficit on the other.
But then we're not going to get paid the full payment that's due to us.
This failure to fund Maine Care will cost the state's rural health care system millions of dollars, starting with Maine Health, which may have to hold off on various projects and push back on updating equipment.
We estimate it would be about a $100 million impact to Maine Health.
Leaders at Northern Light, one of the largest healthcare systems in the state and the largest in northern Maine, have been vocal about recent financial struggles. They estimate they will lose $24 million in cash flow due to the cuts, forcing them to scale back on services.
And I think when you think about a state like Maine, where access is important given the geographic dispersion of the state, it starts putting access at risk for patients.
11 rural hospitals in Maine are at risk of closure in the near term, and 5 hospitals are in immediate jeopardy of closure, according to the industry group Becker's Hospital Review. Those numbers leaving Maine's healthcare system at a breaking point. In Portland, Raya Wooten, News Center Maine.
Democratic leaders in the state Senate say they would like to see more compromise from Republicans on the budget. However, Maine Senate Republicans say they couldn't support a supplemental budget that did not include reforms to address the Maine Care shortfall, as they push for changes they say will make the program more sustainable.